welcome to another edition of Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and Chief Surgeon of UH County Medical Center. Doc, how you doing?
Oh, can't complain at all. It looks like it might cool off.
It's kind of nice out there today.
Yeah.
You know, I had a great night last night. I was telling Maddie that threw a couple burgers on the grill, had fresh tomatoes from the garden and onions and corn on the cob. It was a great evening.
It doesn't get better than that.
No, this is the time.
This is the time.
This is the time.
Yeah.
Hey, before we get started today, and I know you got some great stuff to talk about today, I got an idea for a show.
Okay.
See what you think.
All right.
I'm sitting there watching the television program, the Indians game, and I'm thinking, you know, a subject that we have never talked about, and it affects me actually, is people that retire. And it affects your mind,
Sure.
it affects your physical abilities, and you need a lifestyle change. And I thought maybe if you research this, you could think of some ideas that maybe would help the folks out there that are in their 60s that retire, whether they want to or not, what they could do to keep themselves physically active and in good shape.
That's an excellent idea for
Wouldn't that be something?
Oh, yeah. Yeah, we will definitely cover that.
And I will learn from it myself. My wife says, quit watching the Westerns and do something, you know, get busy. So,
you like Westerns too?
Yes, I do.
Those
I
are
love
my
Westerns. All right, Doc, I haven't seen you for a couple of weeks. What are we going to talk about today?
Well, you know, Pat, I'm sure you recall and folks recall that there was a time on the AM Live show when we used to cover emerging things in medicine.
Yep.
Like crazy, wild things going on out there.
Yeah, it was almost like science fiction.
Yeah, well, that has not slowed down at all. And so I thought what I do is just give the public an idea of some of the things that are going on out there.
Okay.
And as you hear these things and think about these things, it will maybe become a little bit more clear how powerful the research is, how powerful the technology is, and some of the enormous changes that are going to come. It's inevitable. It's going to come. The research is being done. It's being published. A lot of these things are well along in development.
Mm-hmm.
And I'm only just going to cover a couple of them here this morning, and
okay.
there's a few more for a future show.
Great.
Okay, but we're going to start off with a concept that they're calling electroceuticals. Okay, no more pills, tiny nerve zapping implants to fight disease.
Mm.
Okay, imagine, I'm going to just read a little bit and then we'll talk about it.
Okay.
Imagine a future where we can treat diabetes or autoimmune disorders with an electric pulse delivered by a device no larger than a speck of dust.
Wow.
Whoa. The device, implanted through microsurgery, sits silently on single nerve bundles. It's got to be the right nerve, obviously.
Mm-hmm.
Monitoring electric signals that are going through those nerves sent out by the brain to itself and various organs, and when it detects a problem, like a rogue misfire of the nerve or a shift in activity patterns, the device powers up, sending out counter pulses to correct the signal. In this way, it keeps your body running smoothly and disease at bay. No pills, no injections, no pain, no side effects.
How far do you think it is away from getting to that point where you would use that?
This is well along in clinical trials, okay? It's along in clinical, and what that means is that the technology necessary to do this exists. It's been tested on animals.
Mm-hmm.
It's effective, it works. And when you think about it, but to answer your question, this is probably 5 to 7 years away.
Okay.
That's not that far.
No, it
It's
isn't.
not that far. The concept is really radical, okay? The technical problems have to do with creating a device that has the appropriate sensor that can sense what it's supposed to sense,
Mm-hmm.
that can deliver the stimulation to the nerve that's necessary, not too much, not too little, very accurate, and then coordinating that so when the sensor senses what it's supposed to, and then stimulates the way it's supposed to. That's a technological problem, and we had talked about nanotechnology and that kind of thing, which is tiny, 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 like almost at the atomic level. This is bigger than that. But the reduction in size of all of this, we would say computer type technology, okay? And the research into developing microscopic power sources and getting the circuitry down to that tiny little size is just screaming. I mean, the research is on fire for that, and they're making tremendous advances at that. So the technical problem of producing a device that is small enough that it can be implanted on one nerve and that will reliably do what it's supposed to do, that technology is well along. They're already testing it. They already have the devices. They're already testing it.
Say, like in my case, I have high blood pressure. Would that be affected? Could that be affected by this? It could.
Yes.
And how long do you think this little dust-like particle would last, or do you have to have it replaced every so often?
Well, the preliminary discussion that I saw was years.
It would last for years?
Last for years.
No kidding.
Yeah, yeah. A couple of other things that will let us discuss a little more. Electrical pulses directly hack into the main language of our nervous system to change its operating instructions. Okay? See, the brain is sending signals out. What's going on in the body is phenomenally complex. The brain receives different areas of the brain receive information from all different parts of the body. Okay, and they monitor obviously the blood pressure, but changes in the chemistry, changes in the acidity, all these different changes in hormone levels. There's all these different things that the body is sensing through certain nerves, and that information is carried back to the brain, where the brain then does things to keep the body stable. That's how it works. But that can go haywire. And a lot of disease is when that kind of thing does go haywire. Okay? So if the brain is not sending out the right instructions, for example, here's somebody with high blood pressure, okay? And the blood pressure is controlled by the tiny little small arteries, not capillaries, but small arteries at the end of the bigger arteries as it starts to go into the tissues. And if they narrow down too much, then it's hard to get the blood through there, so the pressure has to go up to force the blood through there. Well, what controls that? Okay? Well, I mean, it can get to the point where, you know, if you have buildup of arterial sclerosis and so on, they narrow down and that's fixed, mechanical. But most of the time, that's not what's going on. Most of the time, those little arteries have muscle in them, and they constrict and they relax. And that's part of the fight or flight thing that we know about. That's a physiologic response. But if those little arteries are getting the message to contract, when the blood pressure is already at a good place, then it's going to make the blood pressure go up. Okay, and for no reason. And then that's high blood pressure. What if you can implant one of these things and it's monitoring the blood pressure, and the brain is sending signals to those little arteries to contract, and this device is sensing, well, the blood pressure is already where it needs to be, it'll interrupt that signal. It will interrupt that signal and cause those arteries to relax. That's kind of an overview of how this works.
Wow.
And you can apply that to a lot of different processes, okay? Rather than using drugs, which are rarely specific for single biological process, that's what side effects are all about. Well, I take this pill, yeah, it helps, but then I got this other problem. That's because it's like a shotgun. You know, you want to hit this little bullseye, and the best thing we have to hit that little bullseye is a shotgun, and it goes all over the place, all right? We could stimulate a major nerve and with surgical precision change the instruction that an organ receives and thereby alter its function. That's what we're talking about, like with the artery example.
Mhm.
This may, like for example, this nerve modification may coax resistant pancreatic cells to release insulin so that blood sugar is controlled better, persuade clenched arteries to relax, or stimulate hyperactive immune cells to stop attacking your own tissue. That's what autoimmune disease is.
Mhm.
So rather than developing a library of chemical drugs that targets individual diseases, a single prototype of these things could in theory be programmed to treat all different kinds. Okay, so what we're talking about here is getting way more precise, okay, way more targeted, and way less invasive, way less chance for side effects, so that the precision that we have in helping people to stay healthy is going to be exponentially increased, much more accurate.
I wonder what that would do to the pharmacy businesses.
Well, these things have to be manufactured and produced. I'm sure they're going to want to get a
No,
little
that's
piece
true.
of that
Yeah,
action.
they probably do. Obviously will.
You know, and we all hear these, I hesitate to even mention this, but these, you know, these conspiracy theories that there's this breakthrough research that gets crushed by pharmaceutical companies because it threatens their profits and so on.
Mhm.
I don't know about that stuff. I'd have to see the evidence. So I don't know. But when this stuff gets out into the sunlight and the cat gets out of the bag and the whole scientific community knows that this is what's going on, it gets difficult to suppress it.
The other question I have, Doc, and probably it's too early to even answer this question, but what would something like this cost a patient?
Well, that would depend on the kind of insurance that they have. That would depend on the kind of insurance that they have. But insurance company, my sense of the matter is even if the upfront cost of doing this was substantial,
Okay.
which I'm not sure that it would be. I mean, it's not a big operation to do this,
Mhm.
okay? But even if it were, my sense of the matter is that the insurance companies would probably leap on it.
Okay.
And the reason for that is that this procedure gets done, it has the desired effect. Insurance companies are not paying for pills anymore. They're not paying for a lot of testing, and perhaps most importantly, they're not going to be confronting the costs of what happens to people when these diseases really take their toll. Okay?
Mhm.
And there's complications, and those have to be managed. Okay? So this is going to be like a ton of prevention. Okay? In May of this year, the the FDA,
Mhm.
FDA approved, as we've talked about,
Mhm.
a device that contracts airway muscles to help people with severe sleep apnea breathe properly without using CPAP.
Really?
Oh yeah, that's been approved.
Wow.
That's how far along this is. Now, I'm going to drop the bomb, okay?
Okay.
Now I'm going to drop the bomb. All right. A month later, the agency also gave its nod to an implantable weight loss device that stimulates a nerve near the stomach to make a person feel full.
Really?
Now, if this comes forward, I mean, it's already been approved,
Mhm.
okay? If this catches on, how popular do you think that's going to be? All of a sudden, there's a tiny micro operation to implant this little thing.
Right. It's huge.
Oh, massive. I mean, this is, I mean, what you're talking about here is basically every pharmaceutical company in the world spending millions and millions and hundreds of millions of dollars of research trying to find something effective for weight loss,
Mhm.
because they know the market for that is just incomprehensible.
Right. Right.
So this has already been approved. So this is not theory. I mean, like I told you at the beginning, this stuff is happening.
Now, let's go back to that sleep apnea thing. Now, that would affect my wife, who is on the, what is it, CPAP, is it?
Oh, yeah.
And it has helped her immensely.
Oh, sure.
No snoring, nothing.
Oh, there's no question. It's very effective.
And she is one of these people that adapted to it within a week, and she said, I wouldn't be without it. When she went on a vacation to the West Coast, she took it with her, and it was no big deal to her.
Mm-hmm.
And it's changed our lifestyle, because I was up half the night some nights with the snoring thing.
Sure.
And that does not happen anymore. But you were saying that the FDA has actually approved a situation where she would not have to wear that any longer.
Now, let me take it. The short answer is yes.
Okay.
Short answer is yes. Now, it's going to vary patient by patient, and it's going to depend on the anatomy, and it's going to depend on how people respond and so
Okay.
on. And I'm sure that as more and more experience is gained with this, the indications are going to be more precise. Indications means who is going to benefit from it and who is it not appropriate for.
Mhm.
So it focuses in.
Okay.
But based on what they're talking about here and the mechanism of sleep apnea, this is going to be applicable to a lot of people.
Oh, sure.
A lot of people.
I can't believe the people that I know that have this problem.
Yeah, it's a bad
And
problem.
Doc, when you say the FDA has approved this, how far are we away from actually seeing it go into effect?
Very close.
Really?
FDA approval is the last step.
Okay.
Once that hurdle is cleared, see, FDA approval means that all of the basic research, all of the phase 1, 2, and 3 clinical trials have already been done. Okay?
Mhm.
That's what has to happen for the FDA to be able to approve something, which basically says the research shows that this does what it says it's going to do, so that the results are reproducible, and that it does it in a way that has an acceptable safety profile, which is very strict in this country.
Mhm.
Okay? So that's what FDA approval means. That's why you remember all those shows where I would tell people, when you go up to these flashy websites, scroll down to the bottom, and in print you can't read,
I
it'll
was
say
just gonna
not
say that.
FDA approved.
Yep, you were a big stickler on that.
Oh man, well, that's because people are getting ripped off.
Yeah, and I remember you did a whole show on that,
Oh, I did.
on the different things that.
that they do.
Yeah,
Yeah, so this has been approved. For those two indications, it's been approved.
That is amazing.
So it's here. This is how medicine is changing. This gives an insight into how medicine is. This is just one insight.
Mhm,
I got a couple of other examples here that I think
Okay.
will also sort of, okay. But you, whoa, brave new world. It's amazing.
Yeah.
It's amazing. And a lot of, there's a lot of research in a lot of these cutting edge areas that's being done by UH. I mean, UH has really turned into a powerhouse for research.
Mhm.
Under Tom Zenni's leadership, it's just been amazing. So, I mean, I just saw an announcement yesterday that the first proton therapy device, which is a device for cancer, proton therapy, very targeted, very specific, much safer than regular radiation, okay, much less scatter and side effects. And the only one available in the state of Ohio is at UH.
Is that right?
That's right. That's
Whoa.
UH. Very, very forward thinking.
Wow,
Yeah.
huge.
Well, we're going to shift gears a little bit here.
Okay.
I'll set the scene for you. Imagine what it must be like for people who wake up after severe trauma or facial cancers to peer into the mirror and see someone unrecognizable staring back because their faces get all busted up or cut up,
Mhm.
you know. Unfortunately, facial features are especially challenging to reconstruct with plastic surgery due to the complexity of bone structures. Very complex, very hard to fix. And the results are frequently disappointing. Things shift, things swell. A team from Columbia University here in the United States took stem cells from little miniature pigs, from their skin actually, and grew these stem cells into living bone, because the stem cell means it can turn into anything.
Mhm.
And they have the science has the technical expertise to be able to cause those cells to go in different directions. And that's all just a function of which part of the DNA gets turned on and which part stays off. So they can manipulate it at that level, say, okay, you're going to form bone. Well, they took these stem cells and grew them into living bone that precisely replicates the original anatomical structure, and then transplanted these bones into these pigs' jaws. These pigs had jaw deformities.
Okay.
Okay? So they have jaw deformities, so they take skin, they get stem cells, they grow it into bone that precisely replicates the bone that needs to be. Okay? They don't have to go and get it from somewhere else, and then they implant that. Okay? 6 months later, not only were there no signs that the immune system was rejecting the implanted bone, no, it wouldn't be. It was their own
Right.
body. But it also was gradually replaced by new bone made from the pig's own bodies. So they implanted this thing that was anatomically correct to reconstruct the face properly,
Uh-huh.
and then the body incorporated it and replaced it with new bone, and it was just like back to normal.
Oh my God, that's amazing.
That is amazing. I mean, in medicine, we see this in the public. You don't really see it too often, but people who have head and neck cancers,
Mm-hmm.
and a lot of times the surgery necessary to get a cure from those terrible cancers is very disfiguring. Or people who have bad accidents, or babies that are born with defects,
Mm-hmm.
what have you. There's all different ways that you can get it so that your face just gets all very, very traumatic, to try to live that way.
You know, Doc, you mentioned this, and it sticks in my mind. Just in the news the other day was the lady that several months ago they threw a rock from the freeway, and it went through her car window and deformed her. And they've tried to bring her back, but it's just like you say, they could not do it. I mean, she's kind of grotesque with this
Sure.
look.
Sure.
This would solve that problem.
Go a long way towards it.
Mhm.
Yeah.
Yeah.
Oh yeah. Oh yeah.
Amazing.
The bone structure would be correct.
Mm-hmm.
Her bone structure would be anatomically correct.
It's amazing.
I mean, think about that. Think about that for all these kids with. I mean, it's just the ability to do that, to take stem cells, cause them to grow into bone, the correct bone, and then implant it and have it work. That's pretty wild.
Mm-hmm.
So that means that there's hope for people who previously didn't have a whole lot of hope.
Yeah. That's beautiful. That's great.
That's a great thing. Okay, well, let's move along then. Just the title of this one will New 3D printed ovaries allow infertile mice to give birth.
Whoa.
Woo! 3D printed ovary? We've heard about 3D printing.
Mm-hmm.
There was this whole big thing when instructions got out and leaked out onto the internet about how to do 3D printing of guns that weren't detectable in metal detectors.
Right.
And what a big problem that was. Well, 3D printing is basically what happens is a computer gives a set of instructions to a printer, which is not like a regular printer that prints paper. What it does is it uses the raw materials that have been developed for the purpose, in this case basically gelatin. And it gives them instruction, the machine is able to take those instructions and construct something out of, in this case, gelatin, that has a very, very fine and refined structure that's deliberately programmed. In this case, it's a very special kind of lattice work within the gelatin.
Okay.
Okay? And they tried a whole bunch of different ones, and they found the one that worked the best. But they can control it at that level. Okay? Scientists at Northwestern University 3D printed a functional ovary out of jello-like material and living cells. Human stem cells derived from skin that have the potential to develop into anything. can be turned into primordial oocytes, which are the kind of cells that give rise to human egg in the ovary. Okay? So you can take these stem cells and stimulate them, and they become oocytes, the egg cells. Okay? And the supporting cells that the ovary needs. That display the same molecular signs of their natural counterparts. Okay? So they take this 3D printed gelatin thing, and put these oocytes into it. Okay?
Okay.
Now what they did was they took some mice, and they took their ovaries out. Okay, obviously they're not going to be able to reproduce because they don't have any ovaries. Okay, they constructed these things in the lab, this 3D printed ovary, put the mice oocytes into it, implanted it into the mice.
Mm-hmm.
Blood vessels automatically came there and started supporting it because these cells send out signals that attract the blood supply. Okay? The mice regained their monthly cycles almost immediately.
Really?
And then they produce litters of healthy pups.
No kidding.
Now let that sink in for a minute. These ovaries are gone. They created an artificial ovary, implanted into the mice, and it worked like a normal ovary. Think about that.
Look at the hope that some people will have now.
Exactly.
Yeah.
Exactly. What that's going to do, I mean, there's going to be a lot of tough questions that people are going to have to answer. I mean, this could extend the human reproductive cycle. You know, ladies go through the change and so on.
Mm-hmm.
This could extend the human reproductive cycle by decades. By decades. Okay, and what about all these people who go through such pain? They're trying to have kids, they can't, and they go through and they do all these fertility clinics and all these things that they have to go through. Okay, just think if they could take that person's stem cells from their skin, create one of these, implant it, and have it work.
It's amazing.
It's worked. It already has worked. I mean, that's what I mean about the research being well along. You know, there's going to be a lot of ethical questions that are going to be raised. There still has to be a lot of work done with human trials and so on. But that's not the technical part of it. The medical part of it is not that far away. It's already worked.
Mm-hmm. Right.
That is going to be here very soon. That is going to be, you can see, I mean, it's already been tested, it's already worked. The human stuff is going to happen. The pressure for that is just going to be intense. People are going to want this, and rightly so. Okay?
Sure.
So, I mean, when you think about that, that's a fantastic achievement.
Sure is. It's amazing.
Okay?
Mm-hmm.
Well, the last one we'll cover today, and this I'm sure will get people thinking.
Okay.
Okay. The title of this article is Robots in Healthcare Could Lead to a Doctorless Hospital. Whoa. Okay, let me set the scene for you. Imagine that your child requires a life-saving operation. You enter the hospital and are confronted with a stark choice. Do you take the traditional path with human medical staff, including doctors and nurses, where long-term trials have shown a 90% chance that they will save your child's life? Or do you choose the robotic track in the factory-like wing of the hospital, tended to by technical specialists and an array of robots, but where similar long-term trials have shown that your child has a 95% chance of survival? That's the choice that's going to be confronting people. I mean, this is not kidding.
Mm-hmm.
Most rational people would opt for the course of action that is more likely to save their child, but are we really ready to let machines take over from a human in delivering patient care? Well, obviously there's no decisions been made, this kind of thing, but this kind of scenario is rapidly approaching, rapidly approaching. Of course, machines will not always get it right, but like autopilots in aircraft and driverless cars that are just around the corner, medical robots do not need to be perfect. They just have to be better than humans.
And you know, you and I grew up with this in the movies and all that stuff, talking about robots taking over the world and stuff. And it's getting to the point where that could be a reality.
On several fronts.
Mm-hmm.
I mean, when you think about it, what's going to stop it, you know?
Right.
What's going to stop it? You know, there's going to be tremendous political ramifications for this and everything else. But if you look at it just in terms of simple cause and effect, okay, there was all this talk about raising the minimum wage, raising the minimum wage. And the people who were for it said, you know, it's so low that, you know, people can't make a living. And the people who were against it said, you know, if you do that, it's going to cost business so much that it's going to decrease jobs, and there won't be the jobs. So there was that kind of a thing. Well, I don't take a political position on it. What I know happened is that there was in one area where this law was passed that raised the minimum wage.
Right.
Wendy's made the decision that they were going to go to basically a robotic business model. A robotic business model. Okay, where, you know, voice recognition technology, and you give your order, okay, and those instructions go to AI, artificial intelligence powered robots that can then construct the meals in an assembly line fashion exactly the way that you want them. Boom, 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 boom. Very fast, very efficient. You know, no worries about overtime, vacation, anything like that. They're just in there working, and all those jobs just go away. Now, that's a huge problem for society to have to deal with that.
Right.
But when you think about it from the point of view of the employer, it's going to cost them less money to go that route.
Mm-hmm.
And they have to try to stay in business. I mean, that's how business works. Okay? So that is one example out of endless number of examples are coming, not just in manufacturing, but everywhere, where you have the ability to get very efficient results, very good reproducible results in this kind of a way. I mean, just the very nature, if you look at human evolution, you know, over the last, you know, couple hundred centuries, it's constantly in that direction, giving us more and more control over the environment, more and more control over our lives, being able to have more security, be able to produce enough food, to keep everybody warm, that kind of thing. That kind of mastery over the environment, there's a tremendous human imperative there, and that's not going to slow down. Too many people want this, okay? So, I mean, obviously it rages, and that's part of the purpose of this show, and that's part of the purpose of this program today, is to throw this stuff out in the open so people can see it, and people are thinking about it, because we all of us, are going to have to be making decisions. All of us are going to be voting. All of us are going to have to be making decisions about how we are going to handle this stuff.
We all will be affected one way or another.
All of us, and majorly. So how long before robots are shown to perform better than humans at surgery and other patient care? It may be sooner, maybe later, but it will happen. It will happen. And my sense of the matter, folks, is sooner rather than later. We can see that one day each of the stages of care through the hospital could be largely delivered by a computer, machine, or robot. Hospitals will be very different places in 20 years. Beds will be able to move autonomously, transporting patients from the emergency room to the operating theater via x-ray if needed. Triage will be done with the assistance of an artificial intelligence device that takes all the information from all the patients and assigns priorities based on hard science. No personal preference on the part of the decision maker, but this is who needs this and that kind of thing. Many decisions on treatment will be made with the assistance of or by intelligent machines. Take a sidebar issue here. They ran a test. I think there was this AI robot. I don't know if it was Waldo, something like that. One on Jeopardy.
Yeah, Waldo.
Was it Waldo one on Jeopardy? Okay. Well, they took that kind of technology and they applied it to this situation. The medical literature is expanding exponentially. New studies all the time, every day, hundreds of new studies being reported. Okay, and trying to keep up with that is a real challenge for every doctor. Okay, well, they set this up so they wanted to query the database. Now let that sink in. They wanted to query the entire medical literature within a certain discipline, whether like internal medicine or for a certain problem. Okay, you're talking about tens of thousands of papers and articles, just on one specific subject. Okay, they wanted to query this with a certain set of parameters to get some recommendations. This is we're going to give this computer this information the patient has. This heart rate, this blood pressure, this is what their chemistries are, these are important aspects of their history, all of that information. We'll give it to you. You query the literature, the entire literature, and come back and give us what you think the top 15 diagnostic possibilities are. That's how this was set up. Okay, do you know how long that it took that computer to query the database?
Not long.
0.6 seconds.
Come on. No kidding. Whoa.
Now think about that. And that means the entire database. 0.6 seconds. And there were the list of the diagnoses.
I'll be darned.
That's already happened, okay? So, I mean, these things are going to be malleable. They're going to be able to target different things and then take these results and then integrate. I mean, it's getting more, and the computing power. I mean, the computers are so powerful now and they're going so fast, and that's like doubling every year and a half. Computing power is doubling every year and a half.
Yeah.
So, so there we go. Your medical information, including medications, will be read from a chip under your skin or in your phone. No more waiting for medical records or chasing information when an unconscious patient presents to the emergency room. Robots will be able to dispense medication safely, and rehabilitation will be robotically assisted. Only our imaginations can limit how healthcare will be delivered.
Yeah. Well, we've seen, you and I have seen in our lifetime, the many changes and the advancements that have been made in all kind of technology.
Oh, yeah.
That's not far-fetched to me.
Not anymore.
No, it could happen very easily.
Oh, it's. I mean, like I said, there is so much pressure on outcomes these days.
Right.
I mean, that's what's driving everything, and rightly so.
Mm-hmm.
Rightly so. I mean, when you come to the hospital, you have to have confidence that you're going to get the very best outcome that's available. That's the fundamental right of a patient, to expect that. And all medicine is integrating now behind the concept of being able to deliver that to the patient, the best possible outcome.
Right.
Elimination of errors, diagnostic accuracy, speed, doing things at the appropriate time, creating a good experience for the patient. I mean, all medicine is integrating behind that. And this is, I mean, just think about that. If you could query the entire medical literature on a subject in 0.6 seconds with a specific set of that means if you were to come in based on your unique history as a human being, your medical history, your medications, the problems that are bothering you now, your family history, all the information that's available about you for medical decision making. And take that and use that as the basis for querying the entire medical literature in less than a second to get the most accurate diagnostic possibilities for you. Who's going to turn that down?
Exactly.
Nobody's going to turn that down. Nobody in their right mind would turn that
No.
down. Okay, and that's what I mean. That's the imperative that's driving this. So it ain't going to slow down.
Mm-mm.
It's now a completely doctorless hospital. That's a ways away.
Right. Right.
That's probably at least. Well, there's probably going to be a prototype up within 10 or 15 years, probably. A widespread, it's going to take a lot longer than that, because the costs are going to be.
Sure.
But I think people can see the inevitability of it. The inevitability of it. So that, the purpose of shows like this are to let people know what's going on and give people a chance to think about this stuff, talk about this stuff, and see how they feel about it.
Yeah, yeah. And it's all new to me,
It's new to all of us.
and to all of us really, and that's why I kind of like that. And you have another follow up to this too in a couple weeks, right?
Oh, yeah.
That will bring out some other stuff that is
Oh, yes.
coming around. I like that stuff. I've always have. It brings them, like you say, it makes us think.
Yeah, it does. I think we all do, Pat. I think it's challenging.
Mm-hmm.
In certain ways, it's kind of frightening, but it's exciting. It's
Sure.
exciting to see what's coming. It's exciting to see what we're going to be able to do.
Yep, I agree.
Well, I was going to include this last question, but I don't think I will. Well, now it's too late. That article on the doctorless hospital.
Yes.
Here is how the article ended. It said, "But who will people sue if something goes wrong?" This, sadly, is one of the first questions many people ask. Well, that's an interesting question.
Yes, it is.
What it really, it's not completely facetious. I mean, who is responsible?
Right.
Who's responsible? Is it the computer programmer who designed the artificial intelligence module that's involved in making the diagnosis? Because there's not a doctor calling the shots here.
Mm-mm. No.
You see what I mean? The
Yeah.
technicians are.
Yeah.
So, I mean, that's just one of the questions that society is going to have to grapple with in this kind of stuff.
Good stuff, Doc.
Well, I hope it's thought-provoking,
Yeah, it is. It very much is.
and I hope it's something that our public finds interesting and helps them kind of think about stuff. And again, if you have questions or if you have topics that you'd like us to cover, if there's anything about what's presented here that you want us to amplify or anything like that, just email my partner in crime here, and
Right.
we will get your questions and we'll get them on the air for you.
Absolutely. And we want to thank everybody for watching today, and we'll be seeing you down the road.